Great. Welcome to East Rock Creek Village's Understanding Your Medicare Open Enrollment Options. Today is Tuesday, October 21st, 2025, and we are so grateful to not only have our members and volunteers here, but also members of other DC area villages. Welcome to everyone, and we're especially grateful today since we are in the beginning phase of Medicare's open enrollment period to have the illustrious Mark Gottlieb with us today. And he is going to enlighten us and allay some fears and support us to navigate and make decisions during this opportunity to make changes to our Medicare coverage. So we will again, Mark is welcoming clarifying questions during the program. You can put bigger questions either in the chat. We will have time for Q&A as long as we just keep on keeping on. So thank you so much, all of you, for being here. There may be others joining us. We may mute you if there's any background noise, but if you put things in the chat, we will see it. And if you let us know that you have something to ask, we will make sure that you're able to. Okay, so welcome, Mark.
All right, good morning.
I'm going to spotlight you for a second there before you put your screen up. Do you want to introduce yourself?
Good morning. Well, I actually had a slide on the topic, but Mark Gottlieb, I'm an independent insurance agent, specialize in what I call the mature market. So my three major areas, excuse me for this little sun blip here. I'm set up near a window and the shade at this time of day is a little tricky, but my main subject matter are Medicare, long-term care, and life insurance, as well as some other things as well. So I do a lot of presentations on the subject. I offer a 6-hour course through Montgomery College. I've also spoken for other organizations. I'll be on this type of chat on Thursday with Iona as well.
Great.
And so, I do a lot of education, try to make people aware of all of their options and all the nuances of the Medicare program.
Great. So now if you can start your slideshow and make it as big as you can, we are looking forward to learning with you and from you.
All right. Would you like me to see if I can expand it?
Yes, please. If you go to slideshow and then there you go.
The bigger, the better.
How's that, folks?
It might be, I may have to
it looks great.
Looks great, but it's big and so it bleeds into the
You're fine. You look great. It's all looking great.
I'm not sure I'll be able to see the whole screen. I'm trying to figure out how to minimize.
You can minimize the pictures of us.
Move you all over so I can have more screen shot time. Yeah, well, that'll help somewhat.
Yeah, you can make the film strip of
Okay,
us.
well, you're down at the bottom. Let's see how it works. I'm not a technologic whiz with these Zoom things, but we will proceed and see how it works. We ready to roll?
It looks great from our perspective.
All right. Well, first of all, thanks very much to Shelley and to David for arranging for this and allowing me the opportunity to present to everyone. Hopefully this will be very helpful. I know Medicare can be a confusing topic, so I'll try to make it a little less confusing and, we'll see what you think. Just quickly, again, I mentioned I have a lot of background in both the healthcare world and the senior service world. I'm certified by almost all of the Advantage supplement and prescription drug plans. I participate in a lot of organizations around the region, provide a lot of educational topics. So we'll start here with enrollment periods because that's something people should be aware of. I'm sure everyone on screen has already gone through their initial enrollment period. So this is put together, for many different groups. Some people may just be approaching their Medicare years. I'm assuming that everyone on is on Medicare. So we're past the initial enrollment period. So happily, we've arrived at the annual enrollment period, which is right now, October 15 to December 7. You can enroll in or change enrollment in a Medicare Advantage and or prescription drug plan for January 1 effective date. In other words, you sign up during this period, whether you sign up October 15 or December 7, same difference in that the new plan will take effect January 1. So you'll have your existing coverage until that time. Now, in this area, I certainly run into a lot of people who have government plans or government retiree plans, Federal Employee Health Benefit Program, GEHA, postal workers, etc. Some may have coverage through other large private companies, and typically their open enrollment starts on November 1st. So there is a difference between the Medicare annual enrollment and the government open enrollment. Just be aware of that. I actually am not involved in governmental programs. Sometimes people will call me and say, well, I'm enrolled in this or such Medicare Advantage plan. I want to change to others. And before I get going on figuring out what the private sector offers in Advantage plans, I find out that they're part of the federal employee program, which also offers some Advantage plans, but they're structured differently. So I just inform them they need to go through either OPM, Office of Personnel Management, or FEP, Federal Employee Program, to deal with their particular issues. So that being said, just to try and clarify that. So again, we're in the annual enrollment period. Now, a lot of people refer to it as the open enrollment period, but actually there is a separate, technically open enrollment period, and that's January 1 through March 31st, during which you can change from one Advantage plan to another. Okay, so you joined an Advantage plan, or you've been in one a while, and all of a sudden you find out it's not working for you for whatever reason. You didn't understand the benefits as you thought you had understood them before you went ahead and signed up. Here's what I call your do-over period. Up to March 31st, you can switch from one Advantage plan to another, no questions asked. There's one other thing that can be done during that period, which a lot of people are not aware of, which is you can leave your Advantage plan and go back to original Medicare, which is, of course, is known as Parts A and B, and get a guaranteed Part D plan. But here's the challenge. That leaves a gap for the 20%. So people with health conditions cannot get approved for a Medicare supplement. So if you say, I'm done with Advantage, I'm going to just get out, go back to original Medicare, and then you find out that you do not qualify for a supplement due to health conditions, that's going to leave you somewhat in a lurch. So you have to be careful about that. The other enrollment period of note is the special enrollment period. Most typically, it's because you're losing employer coverage. So you're employed, you have coverage through your employer plan. And then at some point you say, okay, I've had enough. I'm retiring, or you're terminating, or any other reasons such as that. You may be losing coverage through a joint policy with a spouse or partner. That would trigger a special enrollment period. Same thing, change of jurisdiction, or moving into a nursing home, or your current Advantage plan is being discontinued. But that will generally happen at the end of the year. So that last couple of words should really be put back up in the annual enrollment period, because typically you're going to get notice, right? And this is the time you're getting notice. You're in an Advantage plan, they give you notice and saying, we're not going to be offering that plan for 2026. You're going to have to find new coverage. The reason I put it into special enrollment, I was thinking of it as that's a time that you're able to make changes, even if it's not during annual enrollment or open enrollment. Okay, so that's important to be aware of. So some of us may be getting notices right now from our Advantage plan saying it's going to be discontinued. You need to find another plan. Well, this may be several pieces of good news on that. Number one, you can shop around and see what other plans have to offer. Maybe they're even better than the current coverage you have. And of course, you could be shopping around anyway, even if you didn't get a notice. I can have a plan that they're thinking I'm keeping it, they're still offering it, but I have the right during the annual enrollment period to shop around and see if anything's better. But what's really great about the current plan being discontinued is it gives you a one-time opportunity to get a guaranteed issue Medicare supplement. So there may even be people who are in Advantage plans because health-wise, they were not approved for a Medicare supplement. Okay, but this gives them an opportunity, a one-time shot to go back in and get a Medicare supplement. So that's a great thing. The last period is called general enrollment period. You missed 8 months to sign up for Part B after losing employer coverage. Then you've got to go through a special general enrollment period. It frankly amazes me how anyone could go 8 months after losing coverage from an employer and not realize they need to sign up for Part B. But if they didn't, then they have to wait till the general enrollment period. So I hope that's a lot of enrollment periods right there. I hope that was clear. If there's any quick questions, I'm happy to take them before moving on. If not, I'll move on. So qualifications for Medicare, as we know, again, those turning 65 or leaving employer coverage after they're 65. So you're employed until you're 68 or 70. You decide to keep your employer coverage. You don't have to. You can, depending on what kind of employer coverage it is, depending on what your premiums are, how good the coverage is, you can keep it or you can switch out. It's called voluntary disenrollment from that plan, and then you can go ahead and sign up for Part B. Okay, so that's something we should know. In addition, there are those who are enrolled in the Social Security Disability Program who qualify after 24 months to get on Medicare before the age of 65. Those with end-stage renal disease or Lou Gehrig's disease can enroll in Medicare immediately, regardless of age. Okay, so here's a few things we need to understand about Part A. Hopefully, we all do at this point if we've had Medicare for a while, but in any case, Part A is zero premium for those, and it could be spousal. So one person works, the other didn't, but as long as one of the spousal legal partner contributed for 40 quarters of 10 years into the Medicare Trust Fund, you're going to get Part A for free. Okay, so that's a great thing. You can buy Part A coverage, full price. This may have to be updated. This is current 509. It may, I read projected maybe to 519 for 2026. I'm still getting some new information about what some premiums, what some rates are going to be in 2026. Okay, so you can buy a Part A coverage. Most of us do not. Most of us have it for free. We're blessed. There is a Part A hospital deductible. So if you only have A and B and you don't have a supplement or an Advantage plan, and you get hospitalized and you think, well, I have Part A, and so it's going to be free. The answer is it will be free coverage after the deductible. Now, again, if you have a supplement that's typically covered as part of the supplement, If you're in an Advantage plan, you won't have that deductible, but you're going to have co-pays for the first 5 or 6 days as hospital co-pays. So it's kind of going to equal out, frankly, or the hospital co-pays may even be a little bit more than that 1676. Again, projected, I'm seeing something from some organizations. Until I get official Center for Medicare and Medicaid statistics, I don't like to change, but some of the groups are projecting that as somewhere around $1,700 for this coming year, 2026. Now, Part A also pay, and of course, Part A, the main things it covers is hospitalization. It also does cover terminal illness through a program called hospice. Part A also pays for the first 20 days of care in an inpatient rehab or skilled nursing facility if the patient had a 3-day prior hospital stay. Hopefully, everyone's aware of this Medicare 3-day prior hospital stay requirement. It was suspended during COVID, but it's back. It's been back at least a year, maybe 2 at this point. So if you don't have the 3-day prior and then you get transferred to a skilled nursing or rehab, you can expect a bill because it's not totally covered. So probably for most people who are going to be transferred to rehab or skilled nursing, they did need that 3-day prior. Hospital could be you had a stroke, a cardiac event, something related to an accident, and the list goes on and on. There's a long list of medical problems any of us can endure. So we have 3 days. They say we really don't think it's a good idea for you to be transferred home. We're going to send you over to the local skilled nursing or rehab, and the first 20 days will be covered. Now, there's also some short-term home care, only short-term, nothing long-term. But if you have a health issue where they need to get you out of the hospital, but you really need some monitoring or some infusion therapy or these types of things, they could send you home and you could get some days at home. And if you get skilled care at home, you can also possibly get some very short-term home health aid assistance, but it only has to be in conjunction with skilled care. So in any case, this year it's been $209.50 a day for those days 21 through 100. So the first 20 days are free. 21 through 100, you start paying copays. I think I might have it on another chart, or again, I'm waiting. I think it's going to be about 219 a day in 2026. And so if you have a Medicare supplement, most of the Medicare supplement plans will cover days 21 through 100. Very good reason to have a Medicare supplement. If you have an Advantage plan, once again, you're going to be paying these copays, but they're going to be accruing towards your maximum out-of-pocket, which for anyone who knows Advantage plans, you're paying copays on every service until you hit an out-of-pocket maximum. So there's the 21 through 100. If you're in longer than that, you've hit the terrain of long-term care. That's a whole other question. So there we go. We're into Part B now. So we got past Part A. I'm trying to see if I can move this. I might be. Oh, sorry. This is when it's advanced. So Part B, I'm sorry. This is when it's full screen. Sometimes this happens. But basically, what this saying, Part B covers, anything that's not, well, it's the same kind of concept. It's anything that's not inpatient, physician visits, emergency room, ambulatory surgery, diagnostics, therapies, etc. Okay, now again, if you have an employer plan that's considered to be creditable, meaning as good as Medicare, you can keep it. But, at that point, you might want to start looking at depending on what kind of plan you have, you're going to want to look at, do I want to switch into Medicare? And that will depend on your costs. Now, I did find out that the Part B baseline premium in 2025 is 185. We've all been paying 185 a month. If you have Social Security, it's being deducted from the amount of money you get through Social Security. Okay, so it's changing now. It'll be 206.50 in 2026. So here we go, 185 to 206. It's another $21. So we're in it for another $250 this year based on the premium. But that's baseline. There's something called IRMA. Some of us may be going, involved with IRMA. The list not yet published. Again, I've seen some provisional numbers. There are going to be increases of anywhere, probably depending on your category, of $30 to $50 per month. IRMA, income-related monthly average adjustments, and that is based on your household income. Households considered up to two people. Again, spouse or legal partner. If you're individual, your individual household. This year, you'd be at 185 baseline if you had a modified adjusted gross income of 106,000 and the household was 212. Now, this is my short form Medicare presentation, although it already seems long, I'm sure, to some of you. But for instance, if you'd like that IRMA table, that's something I can shoot over to Shelley to share with you. So I have the table for 2025. I'm waiting to modify it till I get official 2026 data from the Center for Medicare and Medicaid and Social Security Administration.
Right.
Okay, so that I could go as high as 612, and I think it may be going up to around 700 in this coming year. So IRMA is significant. Yes. Did I hear a question? No, maybe that's just some reverberations here.
Right.
You hearing anything, Shelley?
No, it looks like it may just be some background noise. I'm going to mute
Some feedback, maybe. Okay. Okay, I clicked the okay, right. So at the top, I really failed to mention. So the main thing we need to know about Part B, as well as what it covers, is that it covers 80%. That's the big thing, and that's what you're always seeing whenever you're seeing the advertisements about Medicare supplements. And of course, if you're getting the mailers, it's going to point out Part B is paying 80%. You're responsible for the 20. That's why you want to buy a supplement. If you get an Advantage plan, you're not responsible for 20%. What you're responsible is that copay methodology that we'll be getting into. Now, with Part B, there is a $257 deductible in 2025. It's projected to be $288 in 2026. Again, there was a Part A deductible, which I said was $1,676 going up to probably around $1,700. There's also a Part B deductible. Now, for those who turned 65 prior to January 1, 2020, so what's that roughly? We're over 70 years old. You would have probably been counseled to get a Plan F if you were signing up for a Medicare supplement. Anyone who turned 65 after January 1, 2020 can only get a Plan G, not an F. So the big distinction between the two plans is if you have an F, it will cover that Part B deductible of $257. If you get a G, the good news is the premium's going to be a little lower. The bad news is you will be responsible for that Part B deductible. The question's going to be when people ask me if they can qualify for either, the one point I'm going to make to them is, okay, Plan F may be $300 more in premium, but that deductible's covered. Now that's, you're almost breaking even to 288. But the question's going to become what happens in the future. This year is going to present tremendous challenges. I really don't know what's going to happen. We all need a crystal ball or a contact in this administration to see what they're planning to do to Medicare. But we all have to be a little cautious about this, as we know. So, I caution, if you get an F, while it costs more, you do not have that Part B deductible to contend with. So again, it may be even right now, but what happens in if a year or two they'd raise the Part B deductible to $500 or more? Then you would have been happy to have an F rather than a G. But again, if you turn 65 after January 1, 2020, it's not an option. You must get a G. Now, there are other plan letters as well, and I have a significant page about Medicare supplements. One other thing people should know about Part B: you go to the emergency room, they do an analysis of you, you're there for a long period of time, you've got some issues, they're uncomfortable releasing you to home, you're going to be counseled to stay at least for one overnight in a, quote, observation unit. Okay, so that is Part B. The hospital observation unit is housed within the hospital complex, but you're still considered an outpatient. So that's Part B. And again, if you have the correct supplementary insurance, no problem. But for people who only have A and B, that can be a problem. You'd be surprised. Some people only have A and B. And you have to caution them about, here's the downside of doing that. They think, well, Part B pays 80%, I'll pay the other 20. If I have a physician visit and it's $200, fine, I'll pay the $40. If I go to the ER and it's $1,000, I'll pay $200, still not having to pay for these premiums. But observation unit is a poignant issue because now you're staying overnight. They're running 100 tests. Your bill's going to be significant. And so that 20% is going to be significant. All right. So there are some programs for lower income people. Part B has a Medicare savings program through which, depending on exactly how they qualify you income and asset wise, you can get on the Medicare savings program. It could even pay for Part B premiums or some copays and deductibles. So people need to be aware of that. Hopefully everyone is. I always make it known in these presentations that anyone who needs more information about these programs, I'm happy to email that to you. The Extra Help Low Income Subsidy Program helps people with lower incomes to pay for the drug coverage. There are 4 categories of income levels by which they determine how your pricing and premiums are going to be decided on. Okay, we don't know what's going to happen with the Medicare savings program. I've read some early indications that that may be, wiped out through this reconciliation bill, which is going to pose, yet another issue for lower income individuals. People who are enrolled in the Medicare savings program are automatically enrolled in LIS, but it's not necessarily so, the other way around. If you're on LIS, doesn't necessarily mean you qualify for the Medicare savings program. Again, if anyone needs more information about that, let me know. Still having
Can I ask a question, a clarifying question here? So the program that I know about for Part B has to do with, it's called QMB,
Yes.
Qualified Medicare Beneficiary. Is that the same as what you were?
That's one of those categories, yes.
Medicare Savings Program, MSP. Okay, thank you.
MSP, there's other categories known as the specified low-income Medicare beneficiary. It's another category as well. Just as an aside, if you're on full benefit, if you're a full benefit dual eligible, I'll get into this in the Medicaid, Medicare section. But if you're full benefit dual eligible or QMB, you can typically qualify for one of the dual eligible plans. But you may choose not to take the dual eligible. You might just have Medicare and Medicaid and certain benefits through these programs, through the Medicare Savings Program. So we've gotten through A and B. Hopefully everyone has a better understanding of those. They're governmental. You apply through the government. The benefits come through the government. After that, we're moving into the private sector. And frankly, that's what I do. Relative to prescription drug plans, Medicare supplement plans, and Medicare Advantage plans. So we go into Part D, prescription drug plan. By the way, A, B, D, we're skipping C. C equals Medicare Advantage. Probably everyone knows that because you get 100 advertisements a day, and they're all flashing the magic C, trying to tell you why you should sign up for Medicare Advantage. So give you reasons you should and reasons you shouldn't. All right, so we're on Part D. If you have A and B, at least you want to get a prescription drug plan. And my advice starting right up front is buy a prescription drug plan, even if you do not use any drugs, if you're lucky enough, or only several inexpensive drugs. I certainly run into people who say, well, I take a high blood pressure medicine, I take a high cholesterol, I get it for $3 at Costco or at Target or wherever. Why do I need to be paying premiums for prescription drug plans? I don't need them now. That's like the same argument I get when I'm talking to people about long-term care insurance, and they say, who needs long-term care insurance? I'm healthy, I'm doing great. That's today. What's going to happen 5 years from now, 10 years from now? We need to be fully protected. So that's my advice to people. Just sign up. The least expensive drug plans are now around $4.40 a month. There was actually a $0 premium plan in 2025. That one's gone to about $5.50. So, all right, round it out to $5 a month for $60 a year. And in those cases, they're lower tiered drugs, and you probably get them for zero instead of having to pay $2, $3, $5 for them, at the drugstore without your prescription drug plan. So to me, it's a no-brainer. I say everyone should look at having a prescription drug plan because in April, if you get diagnosed with something, they start using some significant drugs. I use April as one of the 12 months of the year. And you now call me and say, all right, well, you've convinced me I really should have a prescription drug plan. I'm going to say, yeah, I didn't convince you well enough because now you need to wait till the next annual enrollment period to enroll in a plan. Okay, you can't just do it when the time comes. That's one of the things about Medicare. We have all these different enrollment periods. So heed that advice. If you're lucky enough to have very inexpensive drugs, just buy a very inexpensive prescription drug plan and you've got it. Okay, so these plans are provided by private insurance company, or they can be provided by managed care organizations as part of their Advantage plan. So Kaiser is an example of a managed care organization. They're a provider organization. They're providing managed care, and they're licensed to provide MAPD, Medicare Advantage prescription drug plans. So if you're in an MA plan, it should come with a prescription drug in most cases. I'll explain that a little further in just a little while. So most are private insurance companies. So you're talking about companies like Cigna, SilverScript, United Healthcare through AARP, WellCare, Humana, etc. So you join the plan, they then subcontract with multiple pharmacy chains. They've all got multiple contracts. Two phases of coverage for those, hopefully you're all aware of this, of course, already. Luckily, we're out of this donut hole deal, and we're out of catastrophic requirements. So those are two great things that occurred that were eliminated over the last few years in the previous administration. So that's a blessing, especially to people who might have even gotten into the catastrophic coverage phase, because that would mean you're never totally free of having to pay some money for drugs. So at this point now, we are out-of-pocket max of $2,000. It's going to $2,100 in 2026. Now, insulin pumps are covered under Medicare Part B, not D. Okay, so two phases at this point. The deductible, $590, going to $615 beginning January. That means during that first phase, your drug costs are going to be billed based on more of a retail model. If you take a very expensive drug, it may actually be in the $500 to $600 range right up front. So it's a good segue. I'm just going to bring you down to this paragraph down at the bottom, where there is a Medicare prescription payment plan, which went into effect last year, which allows you to average out the costs over a 12-month period. So, you might say, oh my God, I've got to pay $590 just in January for this very expensive drug, or January and February. Well, if you join the Medicare prescription payment plan, you can sign up with any of the companies. They'll send you the form. You can so designate. You can average the costs of your drugs over the course of a year. So if you use round it to 600, and that's the only drug you take, one very expensive drug, you're going to average it out, and they're going to ask you in January for $50, 1/12 of that full cost of the drug, rather than right up front the full amount. That's another great innovation, I think. Once you hit that deductible, you then enter into the tier system, and that's a series of copays and, different drugs, generics, brand, specialty. There is a tier 6, which is insulin, $35 a month, regardless of which prescription drug plan you join. That's something that took place over the last few years as well. Another nice addition to the prescription drug plan program. So remember now, your plan selection needs to be based on the total cost, which is composed of premium plus the cost of copays, again, up to $2,100. That does not include premiums. So you're going to have a premium of X dollars a month, then your drugs up to $2,100. It's not, if your premium is, $500, then you only have another $1,600 till you hit the 21 out of 100. The 2,100 is based on the drugs themselves. So you have to be careful. Some people will think, well, the lowest premium drug plan is the one I want. Why would I pay $28 for this plan if I can get this one for $5 a month? And the answer is because you have to do your analysis you can do it on Medicare.gov if you'd like. I offer options for people. I try to help them, or at least send you directions on how to do it. It's fairly simple. If you go to Medicare.gov and put in a few answers to a few questions, and you can enter each drug. They'll have drop-down boxes for exactly what, is it a tablet? Is it a capsule? Is it 10 milligrams? Is it 50 milligrams? Do you need 2 a day? Do you need 5 a day? You put in all the information, and it spits out starting with the least total cost composed of the premiums and cost of copays. Okay, so that's what you need to look for. And you want to make sure if you go to plan details, here's the other thing I caution people on. Okay, so XYZ plan, I don't want to show any, credence to any of the plans out there. I could use any name of any of the plans, comes up as the least cost plan. So you say, oh, that sounds good. Let me check the details. You're going to hit a box called Plan Details. And on that very first page of the detailed analysis of all the drugs, what tier they're in, etc., there is going to be something which says, this is how many drugs are in the formulary. Okay, the formulary is the company's list of approved drugs that they offer in this plan. So if you find least expensive, you click on plan details and it tells you 5 out of 6 of your drugs are in the formulary. Uh-oh, that means there's one drug that is not going to be covered. Scope down, they're going to show you which drug is not covered. They're typically some of the higher priced drugs. And now you got to go down to the list, go next to the next set of plan details, the next set. Hopefully you'll find one of the first 3 or 4 that include all of your drugs in the formulary. The total cost may be a little more, but you know that drug's in the formulary. If you can't find it, in some cases I run these things with people. I go the first 5 or 6, this drug is not in the formulary. None of these companies want to approve it. Okay, now your choices are you got to go to your physician and say, are there alternatives for me? Okay, because you need something, hopefully, that there's an alternative that will work and that's in the formulary. The other thing you have to do if you can't find anyone covering it is in some small amount of cases, you're just going to have to do retail. You're going to end up going to one of these drug discount programs. GoodRx is the most well-known. You can put in the specifics of the drug and it'll shoot out to you what are the costs of that drug retail at each of the pharmacies. They'll tell you here's how much it is at Target, here's how much at CVS, Walgreens, on and on and on. All right, but you want to try and find plans where everything is in the formulary. If not, you want to be speaking to your physician. One other thing about the Medicare Plan Finder, you may put a drug name in there and a little box is going to pop up and it says this drug comes in a generic form. Would you like us to give you the cost generically? Well, you need to understand before you just say yes. You have to make sure that the generic is just, supposedly it's just as good, just as effective. But for some more significant drugs, you want to check with your physician. I had a personal experience with that kind of issue. So you have to go to your physician again, see, are you comfortable with me taking the generic? Some cases they may have to run some blood tests or lab work to see if that generic would be as good for you, as compatible for you as your blood chemistry is to be able to use that drug. Anyway, so be aware of that. It's always easy to just say, yeah, give me the generic. And for some things, not a big deal. But if it's a drug for your brain or for your heart or for your neurologic system, yeah, you better well check with your physician before you say, yes, I'll take the generic. The good news is even for some of these more significant drugs, again, we're going to be looking at copays limited or at a maximum of $2,100. So there you go. So, at the bottom, I think what I was saying here, I still haven't figured out how to minimize this, and I don't like messing around with my screen or it messes up the whole presentation. But I think what I was saying here is a person should shop around because the drug plans differ. This year, there's certainly some changes. Don't assume that the plan you have is the plan you should keep. okay? And there's no religious plan that, oh, I have this plan. I joined it when I was, 65 or when I stopped working at 68. What, it's working. Why? Yeah, it's working. But guess what? You just got a notice that says that premium's going from $15 to $60. And maybe there's some drugs in the tiers which have changed. Don't be stubborn. It's a matter of affordability. Most of these drug plans that from major companies, and if you can make a switch, there's nothing wrong with making a switch, frankly. All right, again, a little more information about Medicare Savings Program and low-income subsidies. I'm just gonna not get into more details about that at this point. I'm probably running behind, and we have some major ground to cover. Uh, Retiree plan coverage is a lot like if you're over 65 and you're still working, you may want to compare Medicare to your employee or your retiree plan. There are a lot of plans out there. There's no one size fits all. There are a lot of different programs, a lot of federal employee plans, for instance. You use Federal Employee Health Benefit Plan as an example. There, even for that, just at the minimum, there's three choices of uh, low option, standard option, high option. Each of them have different premiums. Each of them have a different outline of benefits. Okay, you want to be able to be educated and look at your summary of benefits, outline of benefits, whatever the word is this company calls it, to be able to look at a list of saying, here's what it'll cover, here's what it won't cover, here are my responsibilities. Again, the federal plans also offer some Medicare Advantage plans within their construct. So if you want to change from an Advantage plan to another, you're looking at the open enrollment period starting November 1 for the government sector. And you want to do a comparison to see, am I better off going to my private Medicare or not? So there's no, as I say, no size that, one size does not fit all by any means, and we need to do our homework. All right, so we have Medicaid gaps. We've covered some of them, Part A and B deductibles, 20% copay for Part B, copays for days 21 through 100 skilled nursing. There's actually something called excess charges, where physicians on the Medicare fee schedule, if they're not fully participating physicians, can charge you excess charges. So we need to be aware of, which physicians are totally participating and which have a different kind of contract with Medicare. A lot of people get surprised by this when they get the bill for the excess charges. Now, again, if you do, several of the supplement plans include the excess charges. You don't have to worry about it. If you do have to worry about it, you're going to have to pay them, but they'll go towards your out-of-pocket maximum if you're on an Advantage plan. Now we come to some categories that people see advertised now that are, really big features of Advantage plans: dental and dentures, vision and hearing, some of acupuncture and podiatry. So this is one of the ways Medicare Advantage plans are trying to encourage people to join up into a Medicare Advantage plan. These are not offered through supplement plans. So for instance, if you get a supplement plus a Part D, a lot of people are then interested in, okay, and now I need a separate dental plan, etc. Over-the-counter medications, typically not covered. So that's just a certain category, although the Advantage plans are now also offering some over-the-counter OTC vouchers by which a person can buy certain things that are not technically covered by the prescription drug program. So it's almost like cash if you have vouchers. Okay, so we've gotten through A, B, and D. some of the issues of retiree plans. Let's get into now supplements and advantage plans. So here's the main points I want to make about advantage supplements. I'll start with supplements. Sold by private insurance companies, offer freedom of choice to use any Medicare provider in the United States. Certainly a great benefit. Plans F, G, and N are the most popular plans. So F, I mentioned, if you prior to January 1, 2020, you join Medicare, you could have a plan F. Otherwise, it's only a G. If you want to do comparative analysis of your costs, you want to look at Fs and Gs. For instance, right now, as I'm helping people look through this, I'm getting quotes from multiple companies for Fs, Gs, and N's. Okay, so you might find out that N is less expensive, and it is, but the N requires a $20 copay per doctor visit and select other outpatient procedures or services. There's a list of Medicare plan codes that I happen to have, if anyone's interested, that would also kick in the $20 copay. So one issue, people want to think about, they go, well, I don't have that many copays. Thankfully, I'm in pretty good health. I'll take a plan in. It's going to be, $40, $50 less a month in premium. And the other side of the equation is, and when I start having more medical issues and I'm doing a lot more visits, I'll just change to an F or a G. And the answer to that is you will not, because you will go through medical underwriting, meaning the insurer is going to want to see what your health is like, what issues you have to decide whether or not they want to approve your application. And so you're not going to just be able to switch out when you start needing a lot of visits for all kinds of outpatient reasons. It's a dilemma. Once again, it's like we really don't know, what our health's going to be like, what the future holds. So that's one of the things people have to consider in their decision-making process. Now, when you join Part B, you're considered to have guarantee issue. They technically call it open enrollment. So there's no medical underwriting for the first 6 months. Excuse me. So I'm either 65 and sign up for A and B, or I'm beyond age 65, but I have employer coverage. I don't switch into Medicare, but when I'm done with the employer coverage, I'm going to sign up for Part B. From the time of your Part B effective date, it goes into effect. You have 6 months to get a guaranteed issue Medicare supplement. It's important for people to know. Some people go, well, I'm not going to bother getting a supplement right now. Again, I'm pretty healthy. I'll pay the 20% that the supplement covers. I don't expect anything that big to happen. And no one ever expects anything to happen, of course. So now you call me in the 8th month and all right, now I'm ready to sign up for a supplement. Okay, how's your health? Well, here's my issues, or issues that just came upon me. I'm sorry, you passed 6 months. They're going to underwrite you and they're going to turn down your Medicare supplement application. So you will need to just join an Advantage plan when the time comes. So that's something people should be aware of. Now, you can also obtain a guarantee issue if you're relocating with a Medicare Advantage plan from another geographic area. A lot of people are not aware of this. So let's say your adult parent is moving to be closer to you. So they're moving to the district and they're coming from Pittsburgh or Kansas City or Los Angeles or wherever they happen to be living. And they have a Medicare Advantage plan. This is their opportunity if they would like to switch to a Medicare supplement plan. Okay, so that's a great opportunity for people if they'd really like to get a Medicare supplement and not be involved in Medicare Advantage. And again, we already spoke earlier, if you're losing your Advantage plan because it will no longer be offered, you have a guaranteed issue right to switch to a Medicare supplement plan. Now, unfortunately, this I'm presenting to you here in the district, and the district does not have the same birthday rule, unfortunately. So I'm sorry to have to say it's part of my presentation, but the District of Columbia does not have a birthday rule, which allows people, even with health issues, to change from one Medicare supplement plan to another without underwriting to try and save money. So there was someone who asked up front about, oh my God, my premiums have risen dramatically. What can I do? And what you can do any time of year, if your health will allow it, you can shop around, change companies. There are a lot of good companies, a lot of people of AARP, they think it's the greatest products in sliced bread. I sell AARP products, by the way, so I'm allowed to make this comment. There are a lot of good Medicare supplements from well-rated insurance companies. So the two biggest companies probably selling supplement plans for a number of years were Aetna and AARP United Healthcare. They also happen to be the companies that seem to be experiencing the largest increases in premiums. So again, in the district, you can't get a birthday rule. The birthday rule says, if you live in Maryland, for instance, the birthday rule says even if you have bad health on the month from your birth date for 30 days, you can shop around for a different plan, no underwriting. It's actually a tremendous program for people in Maryland and Virginia. And unfortunately, the district goes by a different set of rules. Maryland, Virginia are able to do it through their state health insurance commissions. The district falls under federal Medicare rules, and they have like kind of a minimum standard for certain things. We're hoping that that will change, maybe even within the next year, but as of now, not the case. But if you don't have major health issues, you can shop around any month of the year and see if you can get a better rate. And I'll tell you, from the person who mentioned $600 a month, I can tell you, if you qualify, you can get a much better rate than $600. That I can assure you, no matter what your age. So, that's just a reality. Sometimes people are in a supplement plan for a long period of time. The rates continue to increase. But if you shop around and you're coming in with a new plan, they haven't had a chance to raise your rates because you're coming in at the rate they're quoting you now. You can actually save some money. So those are my major points about supplement. This is always a work in progress. I apologize. So one other type of Medicare supplement plan, and it is called high deductible. You can get a high deductible plan. The premiums are great. The caveat is you have $2,900 deductible, okay? So, I'm buying a supplement plan, now I have to put $2,900 out of my pocket, to before it'll kick in. Once you pay your $2,900 plus your premium, of course, then you're 100% covered. Does it make sense? A lot of people don't like the concept. They're putting up the first $2,900. But if you don't have that many medical expenses, you've got a low premium and you pay some money out of pocket. Worst case, you pay the $2,900 and then you're done. And as compared to an Advantage plan with the supplement, you can go anywhere in the country to any Medicare provider. So that's my Medicare supplement story. Now I'll try to finish up within the next 10 minutes. I hope that's okay. Medicare Advantage plans, since this is, of course, a huge feature of the annual enrollment plan, period that we're in right now. So we're being bombarded with literature, with presentations, with phone calls from, benefits people all over the country. So be careful about that. Don't do anything over the phone, that's for sure. Do your diligence, do your homework. There are a number of plans out there. Which one is best for you? Uh, so advantage points provided by insurance companies or again by a healthcare delivery system. I'll use the example of Kaiser again, Hopkins in Maryland, and now they have one plan in Virginia. There again, a healthcare delivery system that has a license to offer advantage plans. Okay, so a lot of local products, AARP, Aetna, AARP, United Healthcare, Humanacare, First Cigna, etc. So Cigna is now, by the way, called Health Spring. So if you see any commercials from Health Spring, it's a rebranded Cigna. I'm not quite sure why they chose to rebrand. I think Cigna's, a fairly recognized name. And of course, they also sell prescription drug plans. In fact, all of these do. Uh, Here's the catch. You must have parts A and B. So, I get a lot of questions. Hey, if I join an Advantage plan, can I avoid that Part B premium? And if you have a higher income, you have a higher IRMA, you really would like to avoid that premium. The bad news is no, you must have A and B to join an Advantage plan, okay? Because that company is going to turn around and bill your Part A and B. They're going to bill the government, the Medicare program, to get paid for the services they're providing to you. And then in addition, you'll pay your copays till an out-of-pocket maximum. So be aware of that. There are multiple types of Advantage plans. There's regular Advantage plans. There's dual eligible, which I talked about. If you're full benefit dual eligible or QMB, you qualify for a dual eligible plan. You're considered to be on both, you're considered on Medicaid in those two categories, and they will provide a tremendous amount of additional benefits to you. There's also veterans plans. They can buy a plan so that they're able to use their community-based providers. They may not have to go to the VA to get services. So they can be very appealing plans, and I'll show you a couple of other things about veterans plans which can be beneficial as well. So why do I want to enroll in an Advantage plan? Well, it sounds good, at least on the surface, not to be negative. You've got your low premiums, you've got your value-added coverage such as basic dental, vision, and fitness memberships. With the dual eligibles, you're going to get enhanced dental, greater amount in your over-the-counter vouchers, and transportation, and some other benefits as well. What are some of the features of Advantage plans? Well, again, copays per service until out-of-pocket maximum. So that's the issue. You've got that low premium, but then you've got the series of copays. Again, managing your medical care expenses is a challenge. Am I going to have a low number of uses of healthcare in the next year? Hey, then Advantage plans are a steal. Or am I going to have a significant issue and I'm going to have lots of copays? Now, the good news in the district is the out-of-pocket maximum is much lower, frankly, than it is in Maryland. I do a lot of work in Maryland. I'm located in Maryland. So the out-of-pocket maximums are less, which could make Medicare Advantage plans more appealing from that perspective. You're less at risk, even if you have to go to the out-of-pocket max. It may be 4,500 or 5,000. In Maryland, it's more like 7,500 to 8,000. Okay, so that's a good thing about the district. There's consistent pricing regardless of age. If you sign up and they tell you the plan's $35, they're not asking you whether you're 65 or 95. They're going to give you consistent pricing regardless of age. That's two clear advantages. No underwriting. As I mentioned, with Medicare supplements, you could face underwriting. With Advantage plans, no underwriting. They'll take anyone with any issue, which is a great blessing. There are HMOs and PPOs. HMOs will only cover in-network providers. They may give you a little bit better deal. They're trying to rein it in. It's a managed care product, but you will not be able to go out of network. Certainly, we all want to check whether we're in an HMO or PPO, which of our physicians, especially, or other treatment providers, let's say you get a lot of therapy, is your therapy group in the contracted with that particular HMO or PPO, because that's going to make a big difference in the dollars out of pocket. You even have to remember that Advantage plans will have different contracts with different hospitals, okay? And urgent care centers. So you want to know if you have particular allegiance to a hospital in your area where you live. You want to make sure that that particular Advantage plan has a contract with that particular hospital. They don't automatically cover all of the hospitals or all of the doctors. There's networks. So that's something we really need to understand before signing up for an Advantage plan. Now, with a PPO, you can go out of network, but it will typically cost you more, okay? In some contracts I've seen, if you're inpatient, if you're in network rather, let's say your copay is going to be, $250 copay for this particular, let's say, ambulatory surgery. If you go out of network, assuming that you go somewhere that accepts the PPO, allows the person to, they'll accept the out of network contract. It might be 40% of the bill. So, if the bill's $2,000, 40% is what, $800. Whereas if you use the in-network provider, it would have only been 400 or 250. So again, you want to understand the difference between HMOs and PPOs. Now, again, the Advantage plans say prescription drugs are included. And they make it sound, frankly, I look at all these advertisements, and I'm a knowledgeable consumer, so I can look at them with a jaundiced eye. They make it sound like you're getting all your prescription drugs. I find them extremely misleading. They're not going to charge you a premium. Like I mentioned, in the standalone prescription drug section, there's standalone premiums starting around $5. They can go all the way up. Now, again, I found some plans that are charging $88 premium, but then your copays are going to be low for certain drugs. That's why you have to do the analysis. But my point on Advantage plans is the prescription drug is built into the Medicare Advantage plan if you buy an MAPD, but the copays still exist for paying for the drugs. The rules are the same. You'll still have up to the $2,100 out of pocket, and they're going to price the drugs in the tiers just like if you had a standalone prescription drug plan. All right, so again, I'm missing the bottom line. I apologize, but here are some of the other features. Sorry about that. Here are some of the other features of these plans. Dental, I should say most offer preventative only. So again, you look at the ads and it sounds like, wow, I have this implant and I have this root canal. I've been waiting to get them done. And if I join this plan, my problems are over. Now, most Advantage plans will offer preventative only, although some are now expanding in this ever, competitive world of Advantage plans. Some are expanding to include some money for treatment. Again, depending on which company and which plan. Each company is typically offering at least two different versions of their plan. One may have higher premium, but then also offer some treatment for dental involved. The others are offering preventative only, meaning a fluoride treatment, set of x-rays, and an exam. Well, it's a good start, but the issue is once those things, uncover the fact that you need some work, now where's the money for those procedures, to get the work done, a root canal, an implant, whatever. So then you can buy up. There is additional coverage and an additional premium. So they might tell you, okay, this plan is $35 premium. And it gives you preventative dental. Yeah, but I want some coverage for my root canals, implants, extracts. Okay, for an additional $30, just using example, each one differs a little bit. You can buy the add-on dental plan, and then you'll have some coverage for that. Of course, the other thing you can do, you can get the preventative services through the Advantage plan, and then instead of paying the additional premium to them for their drug plan, which for their dental plan, which may also mean you have a certain number of dentists you can go to, you might want to buy, quote, a standalone plan. Once again, there are a number of companies that offer just freestanding or standalone dental plans. That's some more shopping we all need to do and decision making we need to do. Advantage plans typically will offer vision, an eye exam, and then $200 for glasses or contact lens. Hearing, pretty much a hearing exam. Most of them offer discounts. You won't get it as part of the package. Again, it's an add-on, especially when you're looking at dentures and hearing aids. You're going to want to shop the different Advantage plans and see what the deal is on dentures and hearing aids. They will differ by, you can get one hearing aid every 3 years versus, both ears every 2 years. Dentures, they have contracts with different national organizations that offer these at a discount. So you will see the literature in their outlines of coverage or their summaries of benefits, which will show here's the cost to you for buying dentures or hearing aids. And if that could be important, they're not inexpensive items. So that may be the determining factor about, hey, I like these two plans, but this one I'm going to get a better deal on a denture or hearing aids. Maybe I'll go that direction. Now, before I go any further, I need to just emphasize, and I'm almost done. Sorry, I've taken a little longer. You want to make sure, again, that your providers and hospitals are in the particular plan that you're planning to select. So if you're thinking of a particular Advantage plan, go to your primary care or your specialist and say, which plans are you enrolled in as being an in-network provider? And that may help you narrow down, oh my God, there's 6 companies worth of plans. Well, my people who care for me participate in these 2 plans, and then we can narrow it down to that immediately and make your decision that much simpler. Advantage plans also usually offer fitness discounts on memberships. Many use a group called Silver Sneakers, which is a national chain which has contracts with Advantage plans. And again, some will offer small amounts of vouchers for over-the-counter purchases. It's like having cash. You can go into any pharmacy and use it for pain creams, for, aspirins, for the millions of things that they sell over the counter that are not prescription drugs. All right, coming to the end here, sorry. Dual eligible and veteran MA plans, both 0 premium. They offer you a lot of, important additional benefits. I will say the one real distinguishing thing I'll talk about, the others we just talked about, something called Part B buybacks. You may see these in some ads. The only buybacks that are available are for those for veterans plans. If you get a veterans plan, then they offer a buyback, which means they will pay some portion of your Part B premium. So you read the particular, outline of coverage or the brochure for the company. It says, hey, we're offering you a $60 buyback if you join. What that means is, let's say you're paying the 185 Part B premium. They're telling you, we'll give you $60 towards that 185 to pay for your Part B premium. So in effect, by joining, you're reducing your Part B premium down to 125 instead of 185. Nice benefit. And you can join an Advantage plan plus have the coverage that you already have. This just expands your world and your options. So here's your Advantage plans in the district. So we can see there's a lot to choose from here. You have an AARP United Healthcare PPO plan. You've got Aetna with 2 plans, an HMO/point of service. It's kind of a hybrid between a PPO and an HMO. Care First has 2 PPOs. Cigna, which is now called HealthSpring, has 2 HMOs and a PPO. Humana has 2 PPOs, and Kaiser offers 3 different versions of HMOs. Now, the plans differ by premium, out-of-pocket maximums, copays, drug deductibles, and tier pricing, etc. So, again, you have to understand what you're getting into. Some of the $0 premium plans may have a deductible associated with them that no one likes. Most Advantage plans don't have a deductible. But if you're paying 0 premium, it's possible you might have an upfront deductible. So things of that sort. We have to really do a comparative analysis of some of these plans. Again, which of my physicians or hospitals most likely to have coverage for on an in-network basis? That's certainly going to be extremely important. So that's really it. If that isn't enough for you in one session, I'll just tell you, I am an agent as well as an educator. I charge no fees and no obligations. So I give people as much information as they like. I help them think things through. If they will apply through me, I get a commission through the particular company that they sign up with. In most cases, sometimes you don't even get that. But all I'm saying is there's no fees. You don't have to worry. If you call me, I'm going to ask you for any money. And the prices are actually the same. So, you call AARP and say, all right, how much is your Medicare Supplement Plan G? They're going to tell you a price. If you ask me, I'm going to give you the exact same price. There's no markup through going from an insurance agent. Other than that, if you have any questions, I try to be free in sharing my knowledge of the subject, consultations readily available, literature, company materials, quotes, etc. Feel free to reach out to me if you'd like. And I try to be as, person friendly as possible and as courteous as possible. That's it. It's the Mark Gottlieb at Gmail. My number's below, which is 332-4337. Shelley, of course, will have it. And if there are any questions, I'm happy to take them.
Great. Thank you, Mark. Oh my goodness. I'm giving you applause using the reaction thing.
Thank you.
It is a treasure trove of information. And we only have a few minutes, but if you can stay, let's see what, if any, questions folks have. I think Susan Davis, you've got your hand up. There are a couple things in the chat. And if you want to come off mute, yeah.
And it's about United Healthcare's Medicare Advantage. I have heard through another agent that they are going to be out of the Medicare Advantage business as of not now, but for 2027.
Well, yeah,
Um,
they already withdrew all the regular plans in Maryland. Now, interestingly, they kept the PPO plan in the district. But
yes.
yeah, they're going through a major restructuring. They've had some challenges. And talking about advantage plans, I thought I had this on my slides. I'm just going to say this, if you don't mind, to finish just before I forget it. One of the issues I'm finding with advantage plans, it's again, sounds great, premiums low, all these add-ons. My doctor even participates. Is there a reason I should join or not join? The only thing I can report that I hear from some people in the field, some of the care managers who deal with the different companies and the decision makers at different treatment, organizations or at hospitals or rehab facilities, is that the advantage plans are really being much tougher on the higher cost, higher length, treatment issues. So what I'm finding is you're getting more prior authorizations. Well, I'm not sure whether we want to approve this MRI at this particular time, but we'll put it in. We'll see if you can get a prior authorization before we go ahead and schedule it. Okay, so that's an issue if you're waiting 2 weeks and you want an answer, tomorrow. So there's also some denials that are taking place for the more extensive procedures or for extended rehab stays that you think you really should have covered, and they're not doing it. So that is a caution with Advantage plans. And, I just share that. Other than that, they should be fine.
It's great.
There's a question also about whether Medicare Advantage, particularly United Healthcare, participates with hospice.
All of them, well, basically, hospice is a federal program. It's Part A. So, yes, they all must participate with hospice. There may
Thank
be
you.
some small copays, but typically, yes, most of it is covered.
Mark, if the government shutdown continues, will people be able to make changes to their Medicare plans? Is one of the questions in the chat.
Well, I think there's a commitment that they have to be processing these applications for January 1 effective date. So there's some issues, let's say with Medicare, you're signing up to get your Part A and B. I hear there is some, slowdowns in service, so to speak, or it's harder to get through to people on the phone, that kind of thing. But as far as I know at this point, the processing of new applications during the annual enrollment period is taking place.
Great. Um, I'm going to stop the recording at this moment, but first I just want to can we all give Mark our appreciations? And I see that, let me just stop the recording. Let's see. Oh, here it is.